Getting pregnant even after using birth control can be the worst thing to happen. Dr. Shelly Patra tells us what are the chances and how you can avoid an unwanted pregnancy.
Now, whenever a patient is following the contraceptive advice given by the doctor, one feels fairly confident that pregnancy will not take place. But this is not always the case. There have been cases reported that pregnancy can take place even while you are taking contraceptive pills and even while you've got a copper-T inserted in the uterus. Let us take both these conditions one by one. If you've had a copper-T inserted in the uterus, there are chances of pregnancy, and pregnancy can take place for two reasons. Number one, if the copper-T gets misplaced inside the uterine cavity. So if it descends a little from its proper position, the contraceptive action becomes much less and pregnancy can take place. And the other reason is that if a copper-T is left inside for infinite number of years, you've forgotten to get it changed, then the action of the copper in the contraceptive device, that is worn off. And again, pregnancy can take place. And the worst case scenario is that a pregnancy takes place with a copper-T, and because the copper-T is in the uterine cavity, the pregnancy cannot get implanted in the uterus. So where does it get implanted? In the fallopian tubes. And that is catastrophic. It's a life-threatening condition, a tubal pregnancy, where the tubes can rupture, they can be torrential internal hemorrhage, and patient can even bleed to death without even knowing that there is any bleeding. So if you have a copper-T inside and you've missed your period, be very alert, be very vigilant, get your pregnancy test done, consult your doctor, and if you're having any kind of dizziness or feeling of ill health, or you've suddenly felt that I'm collapsing, I'm falling, that could be a sign of internal hemorrhage. So vigilance is of paramount importance. Do not neglect a copper-T. Get it inserted by a qualified practitioner. So there is a proper fundal insertion. The copper-T is inserted at the right place. And get a regular follow-up done as advised by your doctor. Now regarding contraceptive pills. The only problem with pills is that people forget. And if you forget to take a pill, well, you can conceive. But that's the unfortunate part of it. So if you forget to take a pill once, remember to take it immediately as soon as you remember. But if you forget for 2 days or 3 days, then you must remember you must use another method of contraception, such as a condom, to tide over this difficult period so that you don't conceive. The only permanent method of contraception is, well, a ligation, a sterilization, either for the lady or for the husband. For a woman, we call it tubal ligation, where both the fallopian tubes, they are just tied or a little clip is put there. And for the husband, it's a vasectomy and OPD procedure. It takes barely a few minutes nowadays. And these are the permanent methods of sterilization. But the temporary methods can lead to pregnancy. So if you are utilizing, and all of us, we use the temporary methods of contraception, we have to be very alert, we have to follow the doctor's orders and be very, very vigilant in case of a missed period.
For more videos related to pregnancy and health, log on to onlymyhealth.com.